Hello everyone. Today's video is about terms of location and the position of anatomical figure. This is a part 4 of this anatomical series. So if this video is helpful to you, please like, comment and subscribe my channel and also share it with your friends. So let's start. So in this video I discuss about terms of location and the position. So what is anatomical position? So anatomical position is a fixed position that helps to describe all the terminology that we used in anatomy. So when a person is in standing upright position with the head facing forward and both arms at the side with the palm of the hand facing forward and slightly away from the trunk, and when the feet are together and parallel, this specific position is called the anatomical position. So this position is fixed and depends on this position we can describe all the terminology that we used in anatomy. So this position helps to ensure the accuracy and the consistency of all anatomical description. So anatomical position is that position when a person is standing upright position and his head is facing forward, both arms at his side and palm of the hands facing forward and both hand makes a small distance from the body. And also feet should be together and parallel. So when in a position when all other conditions are fulfilled, this specific position is called the anatomical position, which helps to ensure accuracy and the consistency of all anatomical description. So what is the importance of all anatomical position and location? The anatomical position is crucial because directional terms that are always referred as if the body were in standing stance, even if a person is sitting, moving or laying down. It also helps to prevent confusion and also allows anatomists and all medical professionals to communicate precisely about the body. So here all of these anatomical positions that I describe in this video. Those are supine position, prone position, lateral recumbent position that can be divided into two types, right lateral recumbent position and left lateral recumbent position. Then a lithotomic position, then Fowler position that also divided into the three types, semi-Fowler position, high Fowler position, standard or mid-Fowler position. So first, what is supine position? When a person is lying on his back, arms by the side and the palm facing upward and the feet are together. This position is called the supine position. Or you can say when a person is lying horizontally on his back or when a person's faces is upward is called the supine position. This position mainly used for the clinical examination or many surgical procedure, for example neck, thorax, abdomen and pelvis. So below see this picture that this person is lying horizontally on his back. So this position is called supine position. See that this person is lying on his back and his arm by his side and palm is facing forward and the feet should be together. So this specific position is called the supine position. Then prone position. So the opposite of the supine position is called the prone position. So when a person is lying on his face, chest and abdomen, this specific position is called the prone position. Or when this person is lying horizontally on his stomach, this position is also called prone position. Or you can say when a person's face is downward, this specific position is called the prone position. And the specific position mainly used for the surgical procedure, for example vertebral column, spinal cord and kidney. Then what is lateral recumbent position? When a person is lying on their left or right side, this specific position is called lateral recumbent position, and this specific position is used for recovery of unconscious patient. It also helps to keep airway open and prevent vomit or during hip, kidney or the thoracic surgery. It can be divided into two types. First, right lateral recumbent position and second, left lateral recumbent position. So when a person lies on their left or right side, this specific position is called the lateral recumbent position. When a person lies on their right side is called right lateral recumbent position, and when a person lies on the left side, this position is called left lateral recumbent position. See this picture that this person is lies on their right side. So this specific position is right lateral recumbent position, and see in this picture that a person lies on the left side. So this position is called left lateral recumbent position. Then lithotomic position. When a person lying on her back with legs up and feet supported in straps, this specific position is called lithotomic position. So this position is mostly used during delivery of a baby. So this specific position mostly used during delivery of baby, or it also used in vaginal examination or perineal operation. See this image that this person is lying position but his legs is up and feet supported in strap. Then Fowler position. When a patient is seated in semi-upright position with the head of the bed elevated. So when a person seated semi-upright position and the head of the bed is elevated, this position is called Fowler position. And this specific position sometimes used for comfort or sometimes for inserting feeding tubes. This position can be divided into the three types. First, semi-Fowler position, second, high Fowler position, and third, standard or mid-Fowler position. So start with semi-Fowler position. When the head of a person or the bed is raised between 30 to 45 degree, this specific position is called semi-Fowler position. So when the head of the patient bed is raised between 30 to 45 degree, this specific position is called semi-Fowler position. It helps promote comforts, aids breathing, especially respiratory or any cardiac condition, or inserting feeding tubes to reduce the risk of the aspiration. See this image that the head of the bed is raised up to 30 degree. So this position is called semi-Fowler position. Then high Fowler position. When the head of a bed is elevated between 60 to 90 degree, this position is called high Fowler position. It also helps to maximize chest expansion for patient with respiratory distress or for the placement of neurogastric tubes. So see this picture that the head of the bed or patient is elevated 60 degree. So this position is called high Fowler position. Then standard or mid-Fowler position. When the head of a bed is elevated between 45 degree to 60 degree, this specific position is called standard or mid-Fowler position. See this picture that the head of the bed is almost closer to the 90 degree. So this position is called standard or mid-Fowler position. It is used for general comfort or post-operative recovery or the surgeries of head, chest or shoulder. Here some of the name of position that I already discussed in my first video of anatomy series. As it also included in anatomical position, so that's why again I repeat this. So this position are anterior position, posterior position, superior position, inferior position, medial, lateral, intermediate, superficial or external position, intermediate, deep or internal position, proximal, distal, unilateral, bilateral, ipsilateral and contralateral. So let's start. So start with anterior position. Any body parts or organ that present toward the front of the body is called the anterior position. For example, the breastbone is anterior to the spine or nose is ventral to the ear. See both of this image that this is a breastbone and this is a spine. So obviously the breastbone is placed in the front of the spine. That's why we can say the breastbone is anterior to the spine. Then posterior position. When any organ or body parts that is placed in the back side of the trunk or body is called posterior. For example, the heart is posterior to the breastbone. See this figure that this is the heart and this is the breastbone. So obviously the breastbone is placed in the front of the heart and heart is present behind the breastbone. So that's why we can say that the heart is posterior to the breastbone. Then superior or cranial position. The organ or the structure that is close to the upper part of the body is called the superior or the cranial position. Here, the cranial refers to the head end. For example, the head is superior to the neck or the neck is cranial to the chest. Means that the head is placed in the upper position as compared to the neck. Or same, the neck is present in upper position as compared to the chest. That's why we can say that the head is superior to the neck or the neck is cranial to the chest. Inferior or caudal. The organ or the structure that is close to the lower part of the body is called the inferior or caudal. Caudal refers to the tail end. So the organ or any body part that is closer to the lower parts of the body is called the inferior or caudal, where caudal means the tail end. So opposite of the superior is called inferior. For example, the feet are inferior to the knees or the knee is cradle to the chest. See this figure that this is a knee and this is a feet. So knee is present above the feet or feet is present below the knee. That's why we can say the feet are inferior to the knee. As same the knee is present below the chest. That's why the knee is cradle to the chest. Then medial position. Any organ or structure that is close to the midline of the body is called the medial position. So what is midline? Midline is the line that is present middle of the body is called the midline. So the organ or any structure that is close to the midline of the body, this time we can say that the organ is medial to the body. For example, the heart is medial to the arm or the nose is medial to the eye. See that this is the heart and this is the arm. So heart is more closer to the midline of the body. As same, this is a nose, this is the ear. So nose is a more closer to the midline of the body. That's why we can say that the heart is medial to the arm or the nose is medial to the eye. Then the opposite of the medial is lateral. So the organ or any structure that is present away from the midline. This structure is called the lateral. Or you can say that any structure or organ or any body parts that is present the side of the body, that is also called the lateral position. For example, the arm is lateral to the chest or the ear is the lateral to the eye. See in this figure that arm and ear both are present away from the midline as compared to the chest and eyes. So that's why we can say that arm is a lateral to the chest and ear are lateral to the eyes. Then intermediate, any structure or body parts or any organ that is present between more medial and lateral structure, that's called intermediate. For example, the knee is intermediate between the ankle and hips. You see in this picture that this is the hips, this is the knee and this is the ankle, and the knee is present between the hips and ankles. So that's why we can say that the knee is intermediate between the ankle and hips. Then superficial or external. The organ that is closer to the outer surface of the body is called superficial or external. For example, the skin is superficial to the muscle. See this figure that the skin is composed of three types of tissue: epidermis, dermis and hypodermis, then muscle, then bone. So the skin is present more superficial as compared to the muscle. That's why we can say that the skin is superficial to the muscle. The opposite of the superficial is deep. So deep or internal, any organ or structure that is further away from the surface of the body is called deep or internal. For example, the bone is deep to the skin or the heart is deep or internal to the skin. Then intermediate, any structure that is present between two structures is called intermediate. For example, the umbilicus is intermediate to the left arm and its contralateral leg, means right leg. See that this is umbilicus, this is left arm and this is right leg. So the umbilicus is present intermediate between the left arm and right legs. Then proximal position, any organ that is present towards or near the trunk or the body is called proximal position. For example, the elbow is proximal to the wrist. You see that this is the elbow and this is the wrist. So the elbow is more closer to the body as compared to the wrist. That's why we can say that elbow is proximal to the wrist. The opposite of the proximal is distal. So any organ or any body part that is present further away from the trunk or body is called distal. For example, the knee is distal to the thigh. See this figure that this is a thigh and this is a knee. And the knee makes more distance as compared to the thigh from the body. So that's why we can say that the knee is distal to the thigh. Then unilateral and bilateral. Any structure that is present one side of the body is called unilateral. Means any organ that is present only one side of the body is called the unilateral organ. For example, the spleen is the unilateral organ because it is located only the left side of the body. So that's why spleen is our unilateral organ. Then bilateral. Any structure that is present on both sides of the body is called the bilateral. For example, the kidney, both legs, that is located on each side of the body. That's why this organ is a bilateral organ of the body. See this figure that the spleen is present only in the left side of the body. That's why spleen is our unilateral organ. But the kidney, legs, that is present both side of the body. Right kidney, right leg, left leg. So kidney and both legs are bilateral organ of the body. Then ipsilateral and contralateral. First ipsilateral. The organ or any structure that is present on the same side of the body as another structure is called ipsilateral. For example, the left arm and the left legs are ipsilateral because both left arm and left leg present in the left side of the body. That's why they are ipsilateral to each other. Then contralateral, the organ or any structure that is present the opposite side of the body from another structure is called the contralateral. Contra means opposite. So for example, the right arm is controlled by the left brain hemisphere. So the right arm is contralateral to the left brain hemisphere. So the organs that is present on the same side is called the ipsilateral and the organs that is present in opposite side is called contralateral. So I discuss about all of this position briefly because I discuss all of these points in my another video. So these all are the overall terminology that I discuss in this video. So that's all. If this video is helpful to you, please like, comment and subscribe my channel and also share it with your friends. Thank you everyone.